So the final part of this chapter discusses discharge planning and teaching. For discharge planning and teaching regarding temperature, you want to encourage the parents to not overwrap or underdress the infant, so you don't want the infant to be too warm or too cold, and teach them how to take an axillary temp. For respirations, you want to teach them the normal variations. You want to teach them that sneezing is normal and it clears the airway, so sneezing is not a sign of sickness in newborns. Teach them how to deal with choking, suffocation hazards, avoid the use of powders. If an infant has a common cold, teach them to feed the infant small amounts. Raise the head of the bed 30 degrees while sleeping, and they can use saline nasal drops to help clear the airway. And you also want to teach them how to appropriately use a bulk syringe. Feeding patterns were covered in chapter 25. Elimination, you want infants to have 6 to 8 voids per day after discharge. Teach them the normal changes in the stool and what the difference between stool for breastfeed babies and stool for for formula-fed babies are different. So the stool for formula babies is 1 stool every 1 to 2 days that are pasty and semi-formed. And a breastfeeding babies have up to 3 stools a day, and they're loose and resemble mustard seeds. And that's just the norm, so bottle babies can have bowel movements more often or less often, and breastfeeding babies, usually I would say 3 would be the minimum number of bowel movements per day, but those are just averages. Safe sleep, as far as positioning, you know your ABCs for life support, but you want to know ABC for a safe sleep position. And so A is alone, B is on the infant's back, and C is in the infant's crib. So you want the baby to sleep alone on their back in the crib. Now, that could be in a bassinet right beside the parent's room. It's actually encouraged that infants sleep in the parent's room, but not sleep in their bed. They need a sleep surface that has no toys or blankets. Babies need tummy time while they're awake to prevent the head from being misshapen. And always teach parents to never leave a baby unsupervised if they're placed on an elevated surface. And this sounds like totally common sense, but people think newborns, they can't roll over, so how would they fall off of the changing table? But it happens. Page 589 has teaching for self-management on infant safety, so those are good to review. For diaper rash, parents should be taught to use plain water and a very mild soap to clean the diaper area. If they do choose to use wipes, they need to be alcohol-free. If the diaper rash is, pretty severe, exposing the buttocks to air helps heal that. You can use a zinc oxide ointment, and if there's yeast involved, then they need to use additional medication to treat the yeast. For clothing, you want to teach them to use the same amount of clothes that they put on that the adult is comfortable on, and maybe 1 additional layer on the infant. Car seat safety. Babies should remain rear-facing for 2 years in the back seat at a 45-degree angle. Infants that are born before 37 weeks may get what's called an infant car seat challenge test in the nursery or the NICU, and this is where parents bring in the infant's car seat and they're hooked up to a monitor, and their heart rate and their pulse ox and their respiratory rate are monitored to make sure they're safe in the car seat for preterm babies. Non-nutritive sucking actually prevents SIDS, so pacifiers are encouraged. If you look at figure 24-27 on page 593 in your book, it shows pictures of safe pacifiers. For bathing, they want to teach your parents to use a neutral pH cleanser, so a very mild soap. Do sponge bath until the cord falls off. Teach them a daily bath is not necessary. It actually dries out the skin. And bath time is a great time for parent-infant interactions. Umbilical cord care. To prevent or decrease the risk of hemorrhage and infection is why we do umbilical cord care. Evidence does not support routine use of any antiseptic solution for cord care, which is different than what we used to do when you used to use alcohol several times a day. Before an infant is discharged, the nurse removes the cord clamp. That's usually removed anywhere from 24 to 48 hours after birth, but you definitely want to make sure you take it off before the baby is discharged. Teach the parents to monitor for signs and symptoms of infection. The umbilical stump falls off at approximately 10 to 14 days. And it's normal when the stump falls off that there be just a tiny small amount of bleeding. That would be normal. Here shows this first picture, a newborn sponge bath at home. And the second picture shows the nurse removing the cord clamp before discharge. Page 595 to 596 in your book has home care instructions for bathing, cord care, skin care, and nail care. And then on page 597 has signs of illnesses. And this is the final slide for this chapter. Infant follow-up care include teaching parents the typical immunization schedule and them being familiar with cardiopulmonary resuscitation of the infant. Practical suggestions for their first week at home include interpretation of crying and use of quieting techniques. And so one of the things in Kentucky and probably in the hospitals you're in, parents are watching a video and signing a contract before they go home on how to prevent shaken baby syndrome. Kentucky has a very high rate of child abuse and a very high rate of shaken baby syndrome. So on box 24-5 on page 596 in your book, it has the period of purple crying. And purple is an acronym for the P is peak of crying. So at 2 months of age is when babies tend to just cry the most. U is unexpected crying for no reason. So teach parents that, sometimes babies just cry for no reason. You want to do everything you can to see, change them, feed them, make sure their temperature is comfortable, but sometimes they just cry. R is resist soothing. So no matter what they do and to help soothe the baby may not stop crying. P is a pain-like face, so they may appear to be in pain and not be. L is long-lasting crying, that up to 5 hours a day of crying is normal. And E is for evening hours, and that tends to be the peak of crying hours is in the evening. So to prepare for your case studies on Tuesday, your newborn and newborn jaundice, a lot of the basics, even the newborn with jaundice, are the same. I'm going to kind of make a little study guide to help prepare for those. This is a lot of content in these 2 chapters, but really studying it will help you prepare for your case studies, and it'll put you a step ahead of to take your exam, your final exam, exam 7 over this unit and preparing for your HESI.